Hello, everybody. I'm just getting everybody admitted here. Did I say good morning, Lisa, or did I say good afternoon?
Good morning, but that's okay.
Well,
It's
that's
just 12.
okay. My second espresso hasn't kicked in yet.
Oh, I could use a second espresso too.
All right. I think we still have some people trickling in that I am inviting into the room. If everybody just wants to go ahead and put themselves on mute, which it looks like everybody is, that would be great. One is still joining. I don't know what that's about. All right, we'll give it maybe one more minute if that's okay.
That works.
All right. All right. I feel bad. There's one per oh, that person got on. All right. We might have a few more stragglers, but we'll get them in afterwards if that works. All right, welcome everybody. Good afternoon, not good morning, like I said earlier. We're super excited to be on and be with all of you guys again today for this another new change in the law, in the employment law. I'm just going to be inviting people, adding them in as they come in. But today we're going to be talking about the Minnesota's meal and rest break law that's going to go into effect in January 1st. And we're going to break it down on what it means for your practice. Lisa, if you mind doing a brief intro to yourself and we'll get started.
Sounds good. My name is Lisa Netzer. I am an attorney working with True North Practice Transitions. I have been working with dental offices for the last 6 years and do a lot of employment law focused on small employers.
Awesome. And for those of you who don't know myself, I'm Shannon Snell. I own Dental Recruiters and as well as Dental Consulting Company, and we do a lot of work with private practices from a recruiting aspect and practice management wise. So we're so excited to have you again today. And for those of you who are new, Lisa and I have joined forces every time there was a change in employment law. So it's a earned sick and safe leave, right? There was Minnesota paid family leave that we did a webinar on, actually several of them, and now it's the new rest break law. So if you have questions related to any of those, we're probably going to bypass those today just so that you know, but we do have recordings of them. So if you need those recordings, we'd be happy to send you those privately. If you wanted to send us an email at hello@dentalconsultingco.com. We'd be happy to send those your way. So the work that I do with practice management consulting, we work in a variety of different aspects within the practice, but our clients are with us on a monthly basis and sometimes 6 to 9 months to 12 months at a time. And all of that comes with support, right? Just general support about management and practice ownership in general. And although I asked Lisa this at the start, when did this actually come out? And she said in May. And so I'm like, why did I feel like one day all of my clients started asking about it? And she made a good point that if you had a employee handbook with, Cedar or Bent Erickson or whoever, they may have sent out a notification like, hey, by the way, there's a new meal and rest break law coming into effect in January. Because I swear I was coaching a client and I came into my email inbox and there was an email saying something along the lines of, what are practices doing about the break every 4 hours? And when I looked at it, I knew the practice manager was a little bit on the newer side. And I'm like, well, maybe she really wants to incorporate this change. There's always been a rest break, right? A meal break and from the state level. But I remember emailing back, like, is there an issue at the practice? I don't have anybody that tracks it. I knew nothing about what was going on. Then 20 minutes later, I got on a call with one of my clients and we were talking about something else and they asked me and I was like, okay, what's going on? No clue. And so they told me and I looked it up and it was interesting. My point of all of this is just to share this announcement came into whether it's our email inbox or we heard it at somewhere or we saw it online, and all of the practices are interpreting it a different way. So this office was like, I said, well, tell me what you're going to do about it. Cause I was curious. And they're like, oh, we're restructuring our hygiene schedule in particular to make sure that we're right on the nose with those breaks. And I said, but what if they don't want that? And they're like, oh, we can't ask, right? We can't. And this is their interpretation of it. There's a waiver, but we can't physically give them the waiver. So we're going to, and so they had all their own rules. And then I emailed or texted my trusty group of office managers who, if you're on the call, you know who you are, but they're boots on the ground, high level office managers that I text often. I said, what do you guys know about this? And they're like, not a whole lot. And then the last part of it was I was at a client's office the following day and she goes, oh, that's not that it's nonsense, but kind of she's like, my team can figure out when they can have a rest break. It's not like they're in their rooms and they literally can't leave and have a rest break. So through all of these different experiences, I was like, all right, I got to get on the phone with Lisa to see what is the buzz all about with this. And in particular, I told her that a lot of our clients' hygiene teams are on unique compensation models that is directly related to how effective they are with their schedule. And what was interesting about this law that is coming out and the changes is that the hygienists that are on this unique compensation model want no part of anybody blocking out 15 minutes in their schedule. But the ones that are paid at an hourly rate probably would welcome a break, right? So it was interesting the feedback that we were getting from those two different sections. And so called Lisa on a Friday, and being the annoying visionary that I am, my team members know it too. It's like, I have this idea, let's put it together. I don't know how to logistically put it together. That's where Erin comes in. So thank you, Erin, for putting all the pieces together. And I said, let's just have a webinar that's a little bit more informal than what we typically have done in the past, and have Q&A, have people submit questions, and then really just clear the air for private practices. So here we are today. We had a ton of questions when people were registering. Lisa has those. If you have any additional ones, please put them in the chat and then we can talk about those as well. But Lisa, you being an attorney, specializing in employment law, transitions, all of the things, your practices rely on you for these changes. And I know I shared with you before this is anybody that I talk to, and even that little group of practice managers that I text all the time, I said, Lisa and I are going to get on do something. And they're like, oh, thank goodness, because she breaks it down so well for us to know, okay, let's just read between the lines. What are we supposed to do? So what is your interpretation of this? What have you heard from your clients, and how do we navigate this as a private practice?
Absolutely. I mean, this has been, it's one of those things where there's been a change in the law, but it's actually a tweak. But because of that tweak, it's reasserting itself out into the ethos. So if you look at the language in the statute, and Erin, if you could put our slides up, this is what the rest break statute actually says. It says that you have to allow each employee a rest break of at least 15 minutes or enough time to utilize the nearest bathroom, whichever is longer. So right away, I want everyone to take a breath, because this law is really meant to address people who have to walk like a mile to a bathroom. We're talking Amazon warehouse staff. We're talking about people who can't get to a bathroom in a reasonable period of time. And that is what the legislature was focusing on when they made this change. Now, my interpretation of this, I have a disclaimer up because there are no court cases about this. This is my interpretation based on reading the statute and looking at the Department of Labor and Industry and Labor, excuse me, Dolly, their frequently asked questions section, and there have not been any rules. There's no enforcement of this yet. And we also need to keep in mind that the Minnesota Department of Labor and Industry and DEED, all those departments are really focused right now on getting Minnesota paid leave off the ground. And another huge enforcement area right now for them is the mischaracterization of some employees as independent contractors rather than employees. I don't see this as a huge area for enforcement for them. I don't think they will have, I think Minnesota paid leave is going to take um, the top level of things, but there are consequences that are written into the statute if you don't follow the law. So I say everything I say keep this disclaimer in mind, which is we don't have a court telling us yet exactly how this has to be done. And for every workplace, this is going to look a little different. All right. So if we go forward one more slide, we're going to go back to that statute language because right away, what it says is that an employer must allow each employee a rest break. So one, a rest break. And instead, in a lot of dental offices and a lot of other offices, you have people who have an opportunity to take a break multiple times during the day, hopefully, or at other, in between patients or at other cracks in the schedule, let's say, you have an opportunity to take a break. But this law appears to require you to make it at least 15 minutes. I would say if you have multiple break opportunities, you don't have to worry about the 15 minutes. This is again, the legislature is really clear about setting a floor and not a ceiling. That said, one of the more important exceptions to this statute is on the department's frequently asked questions section, and that's the next slide, which is that this law does not actually apply to people in a professional capacity. Now, if you have workers in a professional capacity, what the heck does that mean? I think the most clear way you could define professionals is if they're licensed by the state or not. Guess what? All hygienists are licensed. Most or a lot of dental assistants are licensed. In either way, they're providing medical care to patients directly. So I think there's a very good argument that your staff who are providing direct care all fall under that professional capacity rule. And that means that right now, without a deeper interpretation of what it means to be a professional, they don't get a break under this particular statute. Of course, doctors, nurses, psychologists, social workers, all those people are licensed. And so those all are people who might be accepted from this particular statute. So in the meantime, so right away we have two exceptions. One, are people going to have a break, multiple opportunities for breaks? Two, are they a professional? This doesn't apply to them. And I've only heard major concern about hygienist staff and not front desk staff. I would say there's a good argument that your front desk staff needs to relieve each other to give break opportunities for them. And so again, if you've never had to have a conversation about this because people just use the bathroom when they need to, you probably do need to have some sort of conversation with them now. There's also another option, which is to take the rest periods and put them together with a half-hour lunch to have a 1-hour lunch period. Now, that does mean that you have to pay for the 2 15-minute parts of it that are actually a break, and half of it is unpaid. So if you're planning to use that, say, for your front desk staff, what you would want to do is make sure that that break time comes within the 4-hour period. They get paid for that 15 minutes. They take another half hour for lunch, and then technically they'd be back on the clock 15 minutes early. They get paid for that 15 minutes, and then they're off to the next 4-hour period. So some people might find this scheduling handy for front desk staff, but given the exception for professionals, I'm hoping most people don't feel that they need to make an exception or build in 15 minutes into the patient schedule at this point in time. So number one, rule always with these sorts of laws is really just, have you talked to your employees? Do they feel like they never get to go to the bathroom all day long and that's just not something that they get to do because they're scheduled too tightly? Is there some time management issues with people between patients? Basically, you need to have a conversation. We're getting a lot of questions about waivers, and the idea that you have to get a waiver every time someone waives a break or things like that. No, I think you will probably have, what you would need and where this might come up So I know some offices do like a shortened day and everyone wants to just do their hours and get out as soon as possible. They probably would sign a waiver for that day or things like that. But you don't need to like continually ask for waivers from people. I'd say it'd be better to document that you had a meeting with everyone, that you talked about bathroom breaks, that you discussed whether people what people want to do about that, how they're handling it, and make sure that you're, taking care of your staff, that they feel that they have an opportunity to be human when they need to be. Shannon, what do you think of that?
Well, it's one thing I said to Lisa because, anytime I'm working with a client, I always like to get challenged with anything that somebody's going to ask me, right? And so as Lisa's talking about, well, you should have a natural break within your workday to go to the bathroom, and I'm chuckling inside as a practicing hygienist. And sometimes we have really busy days, right? We're scheduled back to back. Assistants are too, right? If you're running a solo column and you're turning over your rooms and you're just working with one doctor. But I know plenty of hygienists that would probably chuckle too and say, I don't really have time to go to the bathroom. However,
Mhm.
or drink water, right? We're all dehydrated. However, sometimes we do that to ourselves as providers. So when we're working with an office and we're seeing, I'm just going to throw out some examples. We do a lot of observations. We're timing the providers on how long they're taking for assessments, how long the exam is, how long the actual cleaning or prophy part is. Are we coding correctly? A lot of times we find that the reason that they're not running behind is because they don't have enough time or the patient's filling out paperwork. It's because a hygienist, this is just an example, might be failing to incorporate a perio protocol with their patients and just really working hard every single visit and running behind because they're treating patients with a high level of disease for the time that it takes to treat somebody that's healthy. Or there might be some things within their operatories that are inhibiting them from being efficient with their time. With assistants too, the same thing. So my point being is that if you feel like you literally cannot breathe throughout the day seeing patients, for example, on the hour as a hygienist, there's a lot more that we can do to create that time than to default to how are we going to maneuver the schedule to make it happen. And Lisa made a great point too, and we use this a lot with our practices is if you have a float or if you have somebody that can help seat your patient or even review medical history while you need to either take a little bit of a rest or whatever, there's unique things that we can do other than specifically blocking the schedule for that.
Yeah. And I think that that's really important to create the opportunities because this law, the idea that there was supposed to be a 15-minute break existed before the legislature updated it in their last session. And so the idea that it's suddenly a problem for people is a little like, well, if we're not talking about how people are scheduled and what is happening in that time, then we're missing an opportunity to work with our staff in a way to make the whole office more efficient. Because if someone's feeling like they can never go pee, that's kind of an issue. You kind of want to know. So a conversation around this doesn't have to be confrontational. It does not have to be, I need you to sign this waiver. Keep in mind, this rule doesn't apply to professionals, but that doesn't mean it's not an opportunity to talk about what you could do to make sure people feel like their needs are being taken care of and that and is there a better way to do something or to change your flow somehow so that people get those opportunities.
Yeah. I love that. And because their team members might be seeing some things online and what there should happen or what shouldn't happen with their breaks, and really taking some time to say, hey, we know that this is out there. This is what we know of the new changes. And we just want to open it up saying, is there anything that we can do better as a practice to allow for breaks. And you're going to have great discussions that even outside of that, maybe you don't meet as a team that often and it's going to bring up some other things, but documenting that you have that's a great idea. So
Mhm. Absolutely. So we did get some questions as people registered that we asked them to go ahead and let us know if they had questions. So we did get a few of those, and also feel free to put them in the chat because we're here more as an informal Q&A more than anything else. So one question was, does an hour lunch starting at the 4-hour mark suffice to fulfill the requirement for breaks and lunch? And the answer is not quite. So the way that if you want to say that you're going to incorporate the into the lunch hour, you're supposed to have the 4 hours within a break within that 4 hours. And the Minnesota Department of Labor and Industry does have on its website very clear, like you would have to start it at 11:45 and then have them come back basically exactly an hour later, and you need to pay for those 2 break periods. It's not just a 1 hour unpaid lunch anymore. Again, keeping in mind that maybe for your front desk staff, you want to look at that break time differently. But again, for professionals, you don't have to. So, you know, that's definitely something you want to think about. But just because you have a 1 hour break naturally in your day, a lot of offices break from 1 to 2 or noon to 1. It doesn't quite address the statute completely. So make sure you take a double look at that and make sure it works for you. Another question we had is it acceptable to have staff sign a declination form acknowledging that they get breaks, but they are as the schedule allows? Again, if someone's consistently not getting the opportunity to go to the bathroom, that just, it doesn't work as well. You could maybe word it as, I have sufficient, that I have a sufficient break or something like that. If it's always up in the air, then I'm not sure if you want to document that. I'm going to be honest with you about that. However, if you move people over to, say, a compensation model where they really have the incentive to not take that break time, I think you're going to get people who sign it. And there's some confusion about who gets people to sign this, and there is no prohibition against the doctors or owners talking to their staff to see who will sign it. There's no one who has to do it. It doesn't have to be office staff or your office manager particularly. And again, I would encourage people instead to maybe have that conversation first and then decide whether you think you need those waivers and document that you had the meeting. In other words, that we met as a group on this day at this time and we discussed this and this is how we're going to handle it. So I think that works too. Another question was, if an employee voluntarily waives their break on an occasional basis, does the signed waiver need to complete it each time? No. I would, again, encourage you guys to talk about how you've been handling breaks before the rule and after the rule. And do you really need someone to waive breaks if they're a professional? Probably not. If it's your front desk staff, does it make sense that they get a chance to take a break, or people could spell each other, or you could schedule that lunch in a way that takes care of that break time? So you have that. And I'm not seeing any other questions in the chat. Maybe we've already answered all the questions. I don't know.
Does anybody else have questions? Drop them in the chat. Maybe this is a good thing, Lisa.
Maybe, you never know.
Yeah.
It was the first time we've been like, oh, we'll just do questions and we'll see what happens.
Yeah. Well, I
Sounds
think it's kind of a relief for everybody. I mean, I'm just going to speak for everybody. I think it's a relief to know that it's not maybe as, I don't want to say as big of a deal as we thought, but yeah. Do you have an example of verbiage for the waiver, or how, if they are going to have a waiver, what does that mean?
So there's no magic language for the waiver, and definitely none. So first of all, the waiver is suggested by the frequently asked questions section of the statute. It's not anything in the statute itself. So if you have people who want to waive, and again, they certainly can, you would just have them sign and date a piece of something that says, I know I have the right to take a break, but I'm declining it at this time. The important thing is too that that waiver, if they ever come back and say, oh, it's just too busy, it's too crazy, I need a break. You guys need to have a conversation. That waiver is not going to save you when that happens. And keep in mind that the department is not going to show up at your office to review what your break periods are. They're going to come if someone's complaining. So if you have someone who's really stuck on this, conversations and documenting those conversations, taking notes, writing things down, letting people know you're listening to them. Those are all the important things that you really need to do. All right. So I looks like, oh, I saw two other comments, but they're compliments, so not questions. So I'm excited. So hopefully this clears things up for people, and we've got a clear statement on the fact that really, everyone was worried about the hygiene columns and what this means for their schedule, and that really, because they're licensed professionals, I don't believe this rule is going to apply to them.
Yeah. Awesome. Well, I know everybody's probably has patients at 1 o'clock, so we'll let you get going on with your day. Thanks for joining us. And if you have any follow-up questions, feel free to reach out to us.
All right. Thanks so much.
Thanks, Lisa. Thanks, Erin.
All right. Bye-bye.